Good afternoon, Graham Cole. I am Mihiraa. Let's start the warm-up session. Can you tell me about a challenging patient care situation you've encountered and how you handled it?
Certainly. In one instance, I had a patient who was extremely anxious about undergoing a procedure. Despite my attempts to reassure them, they were still very apprehensive. I took the time to sit down with the patient, listened to their concerns, and provided detailed explanations about the procedure, addressing each of their fears. I also involved other members of the healthcare team, such as the patient's doctor and a mental health specialist, to provide additional support. By taking a compassionate approach and ensuring open communication, we were able to alleviate the patient's anxiety and successfully complete the procedure.
How do you prioritize patient care tasks when you have multiple patients with varying needs?
Prioritizing patient care is essential in nursing. I typically start by assessing each patient's condition and identifying any urgent needs. For example, if a patient requires immediate medication administration, or is experiencing a medical emergency, I address those needs first. Next, I prioritize tasks based on the acuity of each patient's condition, and any scheduled procedures or treatments. Throughout my shift, I continuously reassess and reprioritize as needed to ensure that all patients receive timely and appropriate care.
Describe a time when you had to collaborate with other healthcare professionals to provide optimal patient care.
Collaboration is a key aspect of nursing practice. In my previous role, I encountered a complex case, involving a patient with multiple chronic conditions who required coordinated care from various specialists. I initiated a multidisciplinary team meeting involving physicians, physical therapists, social workers, and other healthcare professionals to develop a comprehensive care plan. We discussed the patient's medical history, treatment goals, and any potential challenges. Through effective communication and collaboration, we were able to provide coordinated care that addressed the patient's physical, emotional, and social needs.
How do you ensure patient safety and prevent medical errors in your practice?
Patient safety is a top priority in nursing, and I take several measures to prevent medical errors. Firstly, I always verify patient identities and confirm medication orders before administering any treatments. I also double-check dosages and follow established protocols for medication administration. In addition, I maintain open communication with patients and their families to ensure that they understand their treatment plans and can report any concerns. Furthermore, I participate in regular training and continuing education to stay updated on best practices and new technologies that can enhance patient safety.
How do you handle stressful situations or high-pressure environments in nursing?
Nursing often involves high-pressure situations, and I've developed strategies to cope effectively. Firstly, I prioritize self-care by maintaining a healthy work-life balance, engaging in stress-relieving activities, and seeking support from colleagues and mentors. During stressful moments, I remain calm and focused, relying on my training and experience to make sound decisions. I also utilize relaxation techniques such as deep breathing or mindfulness exercises to manage stress in the moment. Apart from that, I recognize the importance of debriefing after challenging situations to process emotions and learn from the experience, which ultimately helps me become a better nurse.
You can now start the role play.
Good morning, Mihiraa. I am your attending nurse Graham Cole. We'll be starting your dialysis sessions next week. It's understandable to feel overwhelmed, but rest assured, we're here to support you every step of the way. Is there anything specific you'd like to know or prepare for before we begin?
Good morning, nurse. Yes, it's all a bit overwhelming, and I want to make sure I understand everything.
Of course. I will explain the next steps in detail. Firstly, a fistula needs to be created. It is a surgically established connection between an artery and a vein in your arm. This connection is crucial for dialysis because it provides a reliable access point for the dialysis machine to remove and return your blood during treatment. Without a functioning fistula, dialysis becomes much more challenging. Mihiraa, do you have any questions or concerns?
I understand. But nurse, I'm curious about how it's done and if there are any risks involved.
It's natural to feel curious, Mihiraa. Let me explain the procedure for your better understanding. It involves a relatively straightforward surgery performed under local anesthesia. Like any surgery, there are risks such as bleeding or infection. However, your healthcare team will take all necessary precautions to minimize these risks and ensure your safety throughout the process. Your well-being is our top priority, and we'll be here to support you every step of the way.
I see. So, having a fistula is quite important for successful dialysis treatment then?
Absolutely. A well-functioning fistula is the preferred method for dialysis access because it's more durable and less prone to complications compared to other types of access. It allows for efficient removal and return of blood during dialysis, resulting in better treatment outcomes and quality of life for you.
That makes sense. Thank you for explaining. Could you also explain what to expect during the dialysis process?
Of course. During dialysis, you'll be connected to a machine that filters your blood, removing waste products and excess fluid. This process usually lasts a few hours and is repeated several times a week based on your treatment plan. While undergoing dialysis, you can relax and engage in activities like reading or watching TV. We'll closely monitor you throughout the session to ensure your comfort and safety.
That doesn't sound too bad. Is there anything I should do to prepare for my first dialysis session next week?
Yes, Mihiraa, there are a few things you can do to prepare for your first dialysis session next week. First, make sure to follow any dietary guidelines provided by your healthcare team. It's essential to stay well hydrated. Moreover, wear comfortable clothing and bring any necessary personal items, such as books or headphones, to help you relax during the session. Finally, please remember that for your first dialysis session, it is recommended to have someone accompany you for support and assistance. While it's not mandatory, having a companion can provide reassurance and help ensure your comfort throughout the procedure.
Sure, nurse. I will consider that. I feel much better knowing what to expect. I appreciate your support.
You're welcome. Before concluding, let me summarize what we have discussed so far, Mihiraa. Firstly, we talked about the importance of creating a fistula, which is a surgically established connection between an artery and a vein in your arm. This connection is vital for dialysis as it provides a reliable access point for the dialysis machine to remove and return your blood during treatment. We also discussed the procedure for creating a fistula, the potential risks involved, and the precautions taken to ensure your safety. Furthermore, we highlighted the significance of having a well-functioning fistula for successful dialysis treatment, as it allows for efficient removal and return of blood, resulting in better treatment outcomes and improved quality of life. In addition, we went over what to expect during the dialysis process, including being connected to a machine that filters your blood, the duration and frequency of sessions, and the activities you can engage in during treatment. Lastly, we discussed preparations for your first dialysis session next week, emphasizing the importance of following dietary guidelines, staying hydrated, wearing comfortable clothing, and bringing personal items for relaxation. Mihiraa, It is also recommended to have someone accompany you for support and assistance during your first session. If you need anything else, don't hesitate to ask. Take care, and we'll see you next week for your first dialysis session.
Thank you so much.